Imagine having a crystal ball for your health. Well, we do. It's called a diagnosis. When it comes to type 2 diabetes, getting diagnosed is like flipping on a light in a dark room. We use simple blood tests to shed light on your body's sugar levels. It's painless, quick, and incredibly important. With the right diagnosis, we can chart a path to wellness together. So, let's shine that light and take charge of your health. Blood sugar tests, such as fasting plasma glucose, oral glucose tolerance test, and glycated hemoglobin test, play a crucial role in diagnosing type 2 diabetes. Fasting plasma glucose test. This test measures blood glucose levels after fasting for at least 8 hours. A blood sample is taken in the morning before eating or drinking anything except water. A fasting plasma glucose level of 126 milligrams per deciliter or higher on 2 separate occasions indicates diabetes. Oral glucose tolerance test. During this test, the individual fasts overnight and then drinks a sugary solution. Blood glucose levels are measured before and 2 hours after consuming the solution. A blood glucose level of 200 milligrams per deciliter or higher after 2 hours indicates diabetes. This test measures the average blood sugar level over the past 2 to 3 months. It reflects how much glucose is attached to hemoglobin, the oxygen-carrying protein in red blood cells. An A1C level of 6.5% or higher indicates diabetes. These tests help diagnose type 2 diabetes by detecting elevated blood sugar levels. They provide valuable information to healthcare providers for early detection and appropriate management of the condition. These criteria help in identifying individuals with elevated blood sugar levels, indicating the presence of diabetes. The criteria primarily rely on blood sugar tests, such as fasting plasma glucose test, oral glucose tolerance test, and glycated hemoglobin test. These tests serve as diagnostic tools, and the results are interpreted based on established cutoff values. However, it's important to note that a diagnosis of diabetes should not rely solely on one test result. Healthcare providers consider multiple factors, including symptoms, risk factors, and additional confirmatory tests, before making a diagnosis. In summary, the diagnostic criteria for type 2 diabetes involve a combination of blood sugar tests, symptom evaluation, and consideration of risk factors. Early detection allows for prompt intervention and management, which can help prevent or delay complications associated with diabetes. Regular screening is essential, especially for individuals with risk factors such as obesity, family history of diabetes, and sedentary lifestyle. Here's an extensive explanation of risk factors assessment and its role in the diagnosis of type 2 diabetes. People with a family history of type 2 diabetes have a higher risk of developing the condition themselves. Healthcare providers inquire about family history to identify genetic predisposition. Excess body weight, particularly around the abdomen, is a significant risk factor for type 2 diabetes. Healthcare providers assess body mass index and waist circumference to gauge obesity-related risk. Lack of physical activity increases the risk of insulin resistance and type 2 diabetes. Healthcare providers inquire about the level of physical activity and encourage regular exercise as part of preventive measures. Hypertension is often associated with insulin resistance and type 2 diabetes. Blood pressure measurements help identify people at increased risk of developing diabetes. The risk of type 2 diabetes increases with age, especially after 45 years old. Healthcare providers consider age as a risk factor and may recommend screening tests for older individuals. Risk factor assessment complements blood sugar tests and symptom evaluation in diagnosing type 2 diabetes. By identifying people at higher risk, healthcare providers can initiate early screening and intervention, ultimately leading to timely diagnosis and management of the condition. Symptom evaluation involves assessing signs and symptoms that may indicate the presence of type 2 diabetes. These symptoms include increased thirst, frequent urination, fatigue, blurred vision, and slow wound healing. While not used as the sole diagnostic criteria, symptom evaluation complements blood sugar tests and risk factor assessment. For example, increased thirst and frequent urination occur when excess glucose builds up in the bloodstream, leading to the kidneys working overtime to filter and excrete it. Fatigue may result from cells being deprived of glucose for energy due to insulin resistance. Blurred vision can occur due to changes in fluid levels in the eyes caused by fluctuating blood sugar levels. Slow wound healing is a result of high blood sugar levels impairing the body's ability to repair tissues. Symptom evaluation helps healthcare providers consider the overall clinical picture when diagnosing type 2 diabetes. It prompts further investigation, especially when symptoms are present along with abnormal blood sugar levels or risk factors. However, it's essential to note that some individuals may have type 2 diabetes without experiencing noticeable symptoms, which underscores the importance of routine screening and risk factor assessment for early detection and prevention. Early detection and prevention play crucial roles in managing type 2 diabetes. Early detection involves screening individuals who may be at risk for developing the condition, such as those with a family history of diabetes, obesity, or sedentary lifestyle. Screening tests like blood sugar tests and risk factor assessments help identify patients with prediabetes or early-stage diabetes. Even modest weight loss can have significant benefits in improving insulin sensitivity and reducing blood sugar levels. Regular monitoring of blood sugar levels, blood pressure, and cholesterol levels is essential for early detection of any abnormalities. For people at high risk or with prediabetes, medications such as metformin may be prescribed to help prevent or delay the onset of type 2 diabetes. However, lifestyle modifications remain the cornerstone of prevention. Early diagnosis of type 2 diabetes through blood sugar tests, risk factor assessment, and symptom evaluation is paramount. Prevention strategies focusing on healthy eating, regular physical activity, and weight management are key in reducing the risk of developing type 2 diabetes. Together, with timely intervention and proactive measures, we can empower individuals to lead healthier lives and mitigate the impact of this chronic condition. For more insightful content on health and wellness, don't forget to like, share, and subscribe. Stay informed, stay healthy,